101. What should a nurse teach parents to prevent sunburn in children? A. Use sunscreen and limit sun exposure. B. Encourage midday sun play. C. Avoid hats or shade. D. Skip protective clothing. Answer. Use sunscreen and limit sun exposure. Rationale. Sunscreen, SPF 30+, and limited sun reduce burn risk per AAP. Option A is correct. Options B, C, and D increase UV exposure risk. 102. Which finding indicates a severe asthma attack in a 5-year-old? A. Mild wheezing on exertion. B. Use of accessory muscles. C. Normal respiratory rate. D. Clear breath sounds. Answer. Use of accessory muscles. Rationale. Accessory muscle use signals severe respiratory distress in asthma. Option B is correct. Options A, C, and D are mild or normal findings. 103. What is the priority action for a child with a suspected spinal injury? A. Move them to a stretcher quickly. B. Immobilize neck and spine. C. Check pulse first. D. Encourage sitting up. Answer. Immobilize neck and spine. Rationale. Immobilization prevents further spinal damage, a priority in suspected injury. Option B is correct. Options A, C, and D risk harm or delay stabilization. 104. Which developmental task should a nurse assess in a 9-year-old? A. Hopping on one foot. B. Understanding rules in games. C. Abstract moral reasoning. D. Writing cursive fluently. Answer. Understanding rules in games. Rationale. At 9, children grasp concrete rules in games. Industry versus inferiority. Option B is correct. Option A is earlier. Option C and D develop later, 11+ years. 105. What is the best way to explain N4 to an 8-year-old? A. Say, it's a tiny straw for medicine. B. Use complex anatomy terms. C. Tell them it's very painful. D. Avoid any discussion. Answer. Say, it's a tiny straw for medicine. Rationale. Simple, relatable terms like straw reduce fear in 8-year-olds. Option A is correct. Options B, C, and D confuse, scare, or neglect understanding. 106. Which condition requires droplet precautions in a pediatric unit? A. Tuberculosis. B. Influenza. C. Chickenpox. D. C. Difficile. Answer. Influenza. Rationale. Influenza spreads via droplets, requiring masks and isolation. Option B is correct. Option A is airborne. Option C is airborne. Option D is contact. 107. How should a nurse administer oral antibiotics to a 4-year-old? A. Force it if they resist. B. Use a syringe with small doses. C. Mix with a full glass of juice. D. Skip if they spit it out. Answer. Use a syringe with small doses. Rationale. A syringe ensures accurate dosing and acceptance in young children. Option B is correct. Option A risks trauma. Option C dilutes dose. Option D neglects treatment. 108. What is a common complication of untreated otitis media in children? A. Improved hearing. B. Tympanic membrane perforation. C. Increased energy levels. D. Better balance. Answer. Tympanic membrane perforation. Rationale. Untreated otitis media can rupture the eardrum from pressure. Option B is correct. Options A, C, and D are not complications. 109. When should a child receive their first influenza vaccine? A. At birth. B. 6 months. C. 2 years. D. 5 years. Answer. 6 months. Rationale. The flu vaccine starts at 6 months per CDC for seasonal protection. Option B is correct. Option A is too early. Options C and D delay initial immunity. 110. What should a nurse assess first in a child with suspected dehydration? A. Skin color only. B. Capillary refill and mucous membranes. C. Hair condition. D. Limb strength only. Answer. capillary refill and mucous membranes. Rationale: capillary refill and dry mucous membranes assess hydration status first. Option B is correct. Options A, C, and D are secondary or unrelated. 111. How should a nurse comfort a 3-year-old during a blood draw? A. Tell them it won't hurt. B. Hold their hand and sing softly. C. Leave them alone to cope. D. Restrain without talking. Answer: hold their hand and sing softly. Rationale: holding and singing provide comfort and distraction for a 3-year-old. Option B is correct. Option A misleads. Options C and D increase fear. 112. Which finding indicates pyloric stenosis in a 6-week-old infant? A. Steady weight gain. B. Projectile vomiting after feeds. C. Normal bowel movements. D. Clear urine output. Answer: projectile vomiting after feeds. Rationale: pyloric stenosis causes forceful vomiting from gastric outlet obstruction. Option B is correct. Options A, C, and D suggest normalcy. 113. What should a nurse teach parents to prevent choking in infants? A. Offer small toys to play with. B. Keep small objects out of reach. C. Feed grapes whole. D. Avoid supervised feeding. Answer: keep small objects out of reach. Rationale: removing small objects prevents choking, a key safety measure. Option B is correct. Options A, C, and D increase choking risk. 114. What is the priority action for a child with a severe burn? A. Apply ice to the burn. B. Stop the burning process and assess. C. Give oral pain meds first. D. Wait for blisters to form. Answer: stop the burning process and assess. Rationale: stopping the burn, e.g., removing clothing, and assessing are priorities to limit damage. Option B is correct. Options A, C, and D delay or worsen care. 115. How should a nurse position a child post-spinal surgery? A. Flat with head down. B. Log roll and keep spine straight. C. Sitting upright fully. D. Prone with legs bent. Answer: log roll and keep spine straight. Rationale: log rolling maintains spinal alignment post-surgery, preventing injury. Option B is correct. Options A, C, and D risk misalignment or discomfort. 116. Which vaccine protects against polio in children? A. IPV, inactivated polio vaccine. B. MMR. C. HIB. D. Varicella. Answer: IPV, inactivated polio vaccine. Rationale: IPV prevents polio infection in children. Option A is correct. Options B, C, and D target other diseases. 117. What should a nurse do if a child's foresight is infiltrated? A. Increase the flow rate. B. Stop for and remove catheter. C. Apply heat to the site. D. Ignore it if painless. Answer: stop for and remove catheter. Rationale: infiltration requires stopping the fore and removal to prevent tissue damage. Option B is correct. Options A, C, and D worsen or neglect the issue. 118. What is a common psychosocial issue for a preschooler in hospital? A. Improved independence. B. Fear of body harm or mutilation. C. Enhanced peer interaction. D. Better coping skills. Answer: fear of body harm or mutilation. Rationale: preschoolers, 3 to 5 years, fear bodily injury during hospitalization, Piaget's preoperational stage. Option B is correct. Options A, C, and D are unlikely. 119. What should a nurse include in teaching after circumcision? A. Bathe the site immediately. B. Apply petroleum jelly to site. C. Skip diaper changes for 24 hours. D. Use soap on the wound daily. Answer: apply petroleum jelly to site. Rationale: petroleum jelly protects the circumcision site and aids healing. Option B is correct. Options A, C, and D risk irritation or infection. 120. Which finding indicates hyperglycemia in a toddler with diabetes? A. Jitteriness and sweating. B. Lethargy and fruity breath. C. Cold, clammy skin. D. Steady energy levels. Answer: lethargy and fruity breath. Rationale: hyperglycemia causes lethargy and fruity breath from ketosis. Option B is correct. Options A and C fit hypoglycemia. Option D suggests normalcy. 121. Which milestone should a nurse expect in a healthy 3-month-old infant? A. Rolling over both ways. B. Sitting without support. C. Crawling across a room. D. Standing with support. Answer: rolling over both ways. Rationale: at 3 months, infants typically roll over as trunk control develops. Option A is correct. Options B, C, and D occur later, 6 to 9 months. 122. What is the best way to assess heart rate in a 1-year-old child? A. Use a radial pulse. B. Auscultate the apical pulse. C. Ask the child to count beats. D. Check skin color only. Answer: auscultate the apical pulse. Rationale: apical pulse auscultation is most accurate in infants/toddlers due to rapid rates. Option B is correct. Options A, C, and D are unreliable or age inappropriate. 123. Which symptom suggests Kawasaki disease in a 2-year-old? A. Mild cough and runny nose. B. High fever and peeling rash. C. Slight fatigue only. D. Normal temperature. Answer: high fever and peeling rash. Rationale: Kawasaki disease features prolonged fever, greater than 5 days, and rash with peeling. Option B is correct. Options A, C, and D are nonspecific or normal. 124. When should a child receive their second DTaP vaccine dose? A. At birth. B. 4 months. C. 12 months. D. 4 to 6 years. Answer: 4 months. Rationale: the second DTaP dose is given at 4 months per CDC for diphtheria, tetanus, and pertussis. Option B is correct. Option A is too early. Options C and D are later doses. 125. How should a nurse administer eye drops to a 5-year-old child? A. Drop directly on the cornea. B. Pull lower lid down and instill in pouch. C. Use upper lid only. D. Skip if the child resists. Answer: pull lower lid down and instill in pouch. Rationale: instilling in the lower conjunctival pouch ensures absorption and safety. Option B is correct. Options A and C risk injury. Option D neglects treatment. 126. What is the best pain management for a child after dental extraction? A. Ice pack and acetaminophen. B. Heat pack and aspirin. C. No pain relief needed. D. For opioids immediately. Answer: ice pack and acetaminophen. Rationale: ice reduces swelling and acetaminophen manages pain safely. Option A is correct. Option B risks bleeding, aspirin. Option C neglects pain. Option D is excessive. 127. What should a nurse do first for a child post-hernia repair with pain? A. Offer solid food immediately. B. Assess pain level and location. C. Apply pressure to the site. D. Ignore it as expected. Answer: assess pain level and location. Rationale: assessing pain guides appropriate intervention post-surgery. Option B is correct. Options A, C, and D act prematurely or neglect care. 128. What is the priority action for a child in status epilepticus? A. Restrain their arms and legs. B. Administer lorazepam. C. Check temperature first. D. Wait for it to stop naturally. Answer: administer lorazepam. Rationale: lorazepam stops prolonged seizures, 5 minutes, a priority in status epilepticus. Option B is correct. Options A, C, and D risk injury or delay care. 129. How should a nurse address a parent's worry about ADHD diagnosis? A. Dismiss it as normal behavior. B. Explain symptoms and refer for evaluation. C. Tell them to punish the child. D. Suggest it's temporary. Answer. Explain symptoms and refer for evaluation. Rationale. Educating and referring for ADHD assessment addresses concerns proactively. Option B is correct. Options A, C, and D misinform or delay diagnosis. 130. What should a nurse do if a child's treatment violates a family's religious beliefs? A. Proceed without discussion. B. Discuss alternatives and document. C. Force compliance legally. D. Skip treatment without noting. Answer. Discuss alternatives and document. Rationale. Respecting beliefs while exploring options and documenting ensures ethical care. Option B is correct. Options A, C, and D violate ethics or neglect duty. 131. What should a nurse teach parents to prevent drowning in toddlers? A. Leave pools unfenced. B. Use life jackets and supervise. C. Allow unsupervised swimming. D. Skip flotation devices. Answer. Use life jackets and supervise. Rationale. Life jackets and constant supervision prevent drowning per AAP. Option B is correct. Options A, C, and D increase drowning risk. 132. Which finding indicates severe croup in a 3-year-old? A. Mild barking cough. B. Stridor at rest and cyanosis. C. Normal respiratory rate. D. Clear voice. Answer. Stridor at rest and cyanosis. Rationale. Stridor at rest and cyanosis signals severe airway obstruction in croup. Option B is correct. Options A, C, and D are mild or normal findings. 133. What is the priority action for a child with a suspected fracture? A. Encourage movement to test it. B. Immobilize the limb and assess. C. Apply heat to the area. D. Wait for X-ray confirmation. Answer. Immobilize the limb and assess. Rationale. Immobilization prevents further injury, and assessment guides care. Option B is correct. Options A, C, and D risk harm or delay action. 134. Which developmental task should a nurse assess in a 12-year-old? A. Riding a tricycle. B. Developing a sense of identity. C. Toilet training completion. D. Skipping with both feet. Answer. Developing a sense of identity. Rationale. At 12, adolescents focus on identity versus role confusion, Erickson. Option B is correct. Options A, C, and D are earlier milestones. 135. What is the best way to explain a CT scan to a 10-year-old? A. Say it's a big picture machine. B. Use detailed radiation physics. C. Tell them it's scary and loud. D. Avoid explaining it. Answer. Say it's a big picture machine. Rationale. Simple terms like picture machine reassure 10-year-olds effectively. Option A is correct. Options B, C, and D confuse, scare, or neglect understanding. 136. Which condition requires airborne precautions in a pediatric unit? A. Strep throat. B. Tuberculosis. C. Influenza. D. MRSA. Answer. Tuberculosis. Rationale. TB spreads via airborne particles, requiring N95 masks and isolation. Option B is correct. Option A is droplet. Option C is droplet. Option D is contact. 137. How should a nurse administer for morphine to a 5 kilograms child? A. Use adult dose halved. B. Calculate dose by weight, e.g., 0.1 milligrams per kilogram. C. Give a standard child dose. D. Skip if the child cries. Answer. Calculate dose by weight, e.g., 0.1 milligrams per kilogram. Rationale. Morphine is dosed by weight, e.g., 0.1 milligrams per kilogram for pediatric safety. Option B is correct. Options A and C risk overdose. Option D neglects pain. 138. What is a common complication of untreated diabetes in children? A. Improved vision. B. Diabetic ketoacidosis, DKA. C. Increased muscle strength. D. Better concentration. Answer: diabetic ketoacidosis, DKA. Rationale: untreated diabetes leads to DKA from hyperglycemia and ketosis. Option B is correct. Options A, C, and D are not complications. 139. When should a child receive their second hepatitis B vaccine dose? A. At birth. B. 1 to 2 months. C. 6 months. D. 12 months. Answer: 1 to 2 months. Rationale: the second hepatitis B dose is given at 1 to 2 months per CDC schedule. Option B is correct. Option A is the first. Options C and D are later doses. 140. What should a nurse assess first in a child with suspected sepsis? A. Skin color only. B. Vital signs and perfusion. C. Hair condition. D. Limb movement only. Answer: vital signs and perfusion. Rationale: vital signs, e.g., fever, tachycardia, and perfusion, e.g., cap refill, assess sepsis severity first. Option B is correct. Options A, C, and D are secondary or unrelated. 141. How should a nurse comfort a 7-year-old during an MRI? A. Tell them to toughen up. B. Explain the noise and hold their hand. C. Leave them alone in the room. D. Restrain without speaking. Answer: explain the noise and hold their hand. Rationale: explaining and providing comfort reduce MRI-related fear in 7-year-olds. Option B is correct. Options A, C, and D increase anxiety or neglect support. 142. Which finding indicates Hirschsprung's disease in a newborn? A. Frequent bowel movements. B. Failure to pass meconium in 48 hours. C. Steady weight gain. D. Normal feeding tolerance. Answer: failure to pass meconium in 48 hours. Rationale: Hirschsprung's causes bowel obstruction, delaying meconium passage. Option B is correct. Options A, C, and D suggest normal function. 143. What should a nurse teach parents to prevent obesity in school-age kids? A. Offer unlimited soda. B. Encourage portion control and exercise. C. Skip meals to reduce calories. D. Avoid all snacks. Answer: encourage portion control and exercise. Rationale: portion control and activity promote healthy weight per AAP. Option B is correct. Options A, C, and D lead to imbalance or poor nutrition. 144. What is the priority action for a child with attention pneumothorax? A. Give oxygen via mask. B. Prepare for needle decompression. C. Check pulse first. D. Wait for chest X-ray. Answer: prepare for needle decompression. Rationale: needle decompression relieves pressure in tension pneumothorax, a life-saving priority. Option B is correct. Options A, C, and D delay critical action. 145. How should a nurse position a child post-adenoidectomy? A. Flat on back with head down. B. Side lying with head elevated. C. Prone with legs raised. D. Sitting fully upright. Answer: side lying with head elevated. Rationale: side lying with elevation prevents aspiration and aids drainage post-adenoidectomy. Option B is correct. Options A, C, and D risk complications. 146. Which vaccine protects against diphtheria in children? A. MMR. B. DTaP.
C. HIB.
D. Varicella. Answer: DT. Rationale: DTaP protects against diphtheria, tetanus, and pertussis in children. Option B is correct. Options A, C, and D target measles/mumps/rubella, HIB, and chickenpox, respectively. 147. What should a nurse do if a child's surgical drain output increases suddenly? A. Ignore it if clear. B. Notify MD and monitor closely. C. Remove the drain immediately. D. Apply pressure to stop it. Answer: notify MD and monitor closely. Rationale: sudden increase may signal bleeding, and D notification and monitoring are needed. Option B is correct. Options A, C, and D, neglect or worsen the issue. 148. What is a common psychosocial issue for a teen post-surgery? A, improved body image. B, concern about scars or appearance. C, enhanced self-confidence. D, better peer acceptance. Answer: concern about scars or appearance. Rationale: teens often worry about body image post-surgery due to scars. Option B is correct. Options A, C, and D are unlikely during recovery. 149. What should a nurse include in teaching after hernia repair? A, resume heavy lifting in 2 days. B, avoid straining or coughing. C, skip pain meds to monitor. D, bathe the site with soap daily. Answer: avoid straining or coughing. Rationale: avoiding strain/coughing prevents recurrence or suture stress. Option B is correct. Options A, C, and D risk complications or discomfort. 150. Which finding indicates hypoglycemia in a 4-year-old with diabetes? A, warm, dry skin. B, irritability and sweating. C, increased thirst. D, steady energy levels. Answer: irritability and sweating. Rationale: irritability and sweating are early hypoglycemia signs in children. Option B is correct. Options A, C, and D suggest normalcy or hyperglycemia.